Okay, friends. Now we are going to discuss one more important question, that is 5 marker question in chemotherapy, that is Cotrimaxazole. Cotrimaxazole is a fixed dose of sulfamethoxazole and trimethoprim. What is it? Is a fixed dose of EST, sulfamethoxazole and trimethoprim. It is approved by the World Health Organization and it is in the ratio of 5:1. That means if 5 gram of sulfamethoxazole is given, then 1 gram of trimethoprim should be added. It is one of the commonly used antimicrobial agent. Now let us see the mechanism of action of Cotrimaxazole. We know that for a development of bacteria, the synthesis of the tetrahydrofolic acid is very important. But this Cotrimaxazole, it acts on the folic acid synthesis and inhibits it. Since we have two drugs in this combination, that is sulfamethoxazole and trimethoprim, it acts differently, like para-aminobenzoic acid, that is PABA, which is essential for the formation of tetrahydrofolic acid. But here the sulfamethoxazole, it competitively acts with folate synthesis and inhibits the step 1, and trimethoprim, it reacts with the enzyme dihydrofolate reductase. So this drug Cotrimaxazole, it acts at the pathway in two different places. Primarily it acts on folate synthesis. In case if it fails, it also acts on dihydrofolate reductase, so it has double effect. This is how the drug Cotrimaxazole works, and this process is called sequential blockade. Then let us see the pharmacokinetic properties. It states that the two drugs interfere with two successive steps in the metabolic pathway, hence their combination produces supra-adductive effect. Sulfamethoxazole inhibits folate synthesis, whereas trimethoprim inhibits folate reductase enzyme. The pharmacokinetic properties of these two drugs match each other almost closely. See, we need to note one thing, यहाँ पे ना the pharmacokinetic property ना अच्छे से मैच हो रहा है, इसलिए this combination works better and hence are selected for combination. They have similar half-life भी similar है, and also optimum synergic effect is seen at the concentration 20:1 in blood tissues. यहाँ पे हम synergism भी देख सकते हैं. Synergism is like one drug increasing the strength of another drug. इसलिए इस combination में like we have different advantage in this combination. Basically one thing, both are bacteriostatic, so it has both has the combination of, means इसका मतलब है it has both combination of bacteriostatic as well as bactericidal effect. It means it kills the bacteria as well as it inhibits the growth of bacteria. Once it is given, it do not allow the bacteria to grow, as well as if it is grown, it kill the bacteria. And since it has same effect, यहाँ पे ना like two drugs acting and it reduces the chances of development of bacterial resistance. अगर टू ड्रग एक साथ वर्क किया ना, अगर एक काम नहीं किया तो अदर काम कर सकता है, इसलिए ये रेसिस्टेंस जो है इसका भी चांसेस कम होता है. देन कम्स फार्माकोकाइनेटिक्स. Cotrimaxazole is well observed for oral administration and is available for parenteral use. डबल धमाका, ओरल भी है, पेरेंटरल भी है. It is also widely distributed including CSF में भी जाता है. तो न्यूरल डिसऑर्डर को भी हम ट्रीट कर सकते हैं. इवन स्पूटम का मतलब रेस्पिरेटरी, इवन मेटाबोलाइज्ड इन लिवर, excreted mainly in the urine, hence dose reduction needed in patients for renal insufficiency. We need to note one thing: whenever the drug is excreted to urine, then we need to take care in such a way that the renal patients, the people with renal issues, should not take it. Then let us see the adverse effect of cotrimaxazole. Cotrimaxazole is well tolerated in most patients, but most of the adverse effect is same of those of sulfonamides, because sulfonamides in this combination, we have sulfonamides in high concentration, that is almost 5:1. The common adverse effect of sulfonamides like skin rashes and everyone's favorite, nausea, vomiting, GI disturbances, dermatitis, and we know sulfonamides, the one of the important sulfonamides adverse effect is SJ syndrome, that is Stevens-Johnson syndrome. See, everyone's favorite appeared: nausea, vomiting, glossitis, stomatitis. Sometimes megaloblastic anemia can be seen due to folate deficiency, and may occur rarely because these sulfonamides, humans don't have this enzyme. We have seen that in the previous video, that human don't have this enzyme which required for the folate synthesis. So it basically acts on the mycobacteria, and sometimes since due to this megaloblastic anemia, there might be, usually megaloblastic anemia is also associated with vitamin D, vitamin B12. So there might be bone marrow suppression, leukopenia, neutropenia, thrombocytopenia. And one thing to be noted is cotrimaxazole is contraindicated in pregnancy because it crosses the fetal placental barrier and might cause fetal asphyxia. So we have different combinations and how it is given. See, 500 gram, 50 gram, that is 5:1 pediatric tablet. 200 milligram, 40 milligram, it is also 5:1. But in some cases it is also 5:1, but in double strength oral intramuscular injection, it is not all it is also 5:1. See, for all the different categories like oral, intramuscular, oral suspension, pediatric tablet, everywhere the concentration is given in the ratio 5:1. Hence it is universally taken by WHO. Now let us see the therapeutic uses. It is used in UTIs, urinary tract infections. It is said that cotrimaxazole is effective for treatment of acute uncomplicated lower UTIs. Cotrimaxazole is effective more in lower UTIs due to gram-negative organisms such as E. coli bacteria, Enterobacter species, it is a bacteria. Usual dose, it is 800 milligram plus 160. Okay, for 3 days. Then it is used for chronic and recurrent lower UTIs, especially in women. Small doses of cotrimaxazole daily, thrice weekly. Here, twice daily for 3 days for acute, but for chronic, it is small doses daily or thrice weekly. For long-term prophylaxis, can be used in treatment of bacterial prostatitis in prostatic tissue. Now let us see, okay, UTI. Now it is RTI. I said like clotrimaxazole also goes to respiratory tract. So here also it can treat. What are the basic respiratory tract infections? That is Haemophilus influenza, This is to be noted. It treats influenza and Moraxella catarrhalis. It is also useful for acute maxillary sinusitis and otitis media. Then comes GI. GI में हमेशा होता है ना बैक्टीरियल डिसेंट्री ड्यू टू शिगेला, E. coli, Salmonella species. But even Cotrimaxazole is used to treat bacillary dysentery or bacterial dysentery. But the preferred agents are fluoroquinones. Fluoroquinones are preferred agent. Next, one of the famous question in microbiology, Pneumocystis cerevisiae. Pneumocystis cerevisiae infection. Even Cotrimaxazole are used to treat Pneumocystis cerevisiae infection. It is usually seen in the patients with HIV, and also it is used for Pneumocystis cerevisiae pneumonia. Alternative drugs are pentamidine, clindamycin, primaquine, and atovaquone. Pentamidine, clindamycin, primaquine, and atovaquone. It also treats nocardia species. We have seen that in the previous video. Then cancroid, which is caused by H. ducreyi. The drug of choice is basically azithromycin, but still Cotrimaxazole is equally effective. Alternative drugs are ceftriaxone, ciprofloxacin. So for the cancroid, we can use the following drugs: azithromycin, Cotrimaxazole, ceftriaxone, and ciprofloxacin. And this is a 3-marker question which is usually asked: the typhoid fever and its prophylaxis. Usually for the typhoid fever, fluoroquinolones, that is ciprofloxacin, ofloxacin, levofloxacin, and third generation cephalosporins are given. But Cotrimaxazole may also be effective. This is to be noted. But the thing is, this prophylaxis is asked for 3-marker question. We will make a separate video on it. Then we will meet in the next video. Bye bye.